Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we're back, and one of the things I was talking about before, we were talking about Donna's cholesterol issue, is these new monoclonal antibodies for LDL reduction, and there's two of them that are in the market. And you have to inject them every 2 weeks. It's a pen-style injector, but for certain people who have what they call a heterozygous LDL receptor issue, you have to imagine that you're a wide receiver going out for a pass, and the wide receiver is the LDL receptor. And what they do is the LDL receptors sit on the outside of a liver cell, and they basically will grab that, what we call low density lipoprotein, LDL. And LDL is the bigger part, this particle that causes cholesterol deposition in your arteries. So they have to clear them out of your bloodstream. So imagine the thing or whatever, and Lurch reaching up out of your cell, grabbing an LDL particle with this cholesterol, bringing it into the liver cell, and then basically metabolizing it. So if you have a situation, and these are studies that they do in certain families, and they find these families that have these issues, meaning they have a deficiency of an LDL receptor, and then they found that basically there's an enzyme that actually blocks the LDL receptor from working. So basically, if it goes up and catches the cholesterol, it comes down, it now is changed, and so this particle, or this protein, attacks it and renders your LDL receptor ineffective to grab another LDL particle. So the same analogy would be, you're the wide receiver going out for a pass, and every time you catch the pass, you basically get knocked out of the game. Well, you have only a number of wide receivers that are capable of catching passes, so eventually you don't catch as many as you should, and therefore your LDLs go up. So what this monoclonal antibody does is it actually blocks the blocker. So that means the wide receiver now has a bodyguard. He can go out, he can catch that pass, and he doesn't get affected, and he comes back to the huddle, and you keep doing this all game long. And this is how you basically get LDL reduction. Now, this is not a cheap product, obviously, and there's a lot of new things are being developed in the monoclonal antibody arena. Some of the chemotherapies for cancer, some of the other things are directed in that particular area. It's where modern medicine is going to go. I've seen it work in a couple of patients. They have to be, it's not a statin, okay? So this does not affect your liver in that respect, and it doesn't affect any other organ in your body. It doesn't have to be ingested, digested, or anything, but it only has a 2-week duration. So you're basically giving yourself an injection every 2 weeks, because you're now getting this antibody to this blocking agent. It's rendering it inactive, so that you can reduce this LDL cholesterol out of your things and out of your bloodstream. And I've seen it work dramatically. I mean, some people LDLs are 160, 170, which is very dangerous, and it can lower it down to a respectable range under 100 in some people, or around 100, which gives you normal ratios, normal work. So you have to have a problem with your LDL receptors. You have to have failed maybe a statin, you couldn't get the result for whatever reason, you couldn't tolerate it, or there's some other issue, and then you might be able to qualify for this injection. And I do think it is a significant game changer in the battle against cholesterol. Obviously, you have to still do your part for diet and regular exercise. Those are all really important to continue to do that. If you don't diet and exercise, you are not going to affect any of these things. It's the same thing about antibiotics. I mean, if you don't have a healthy immune system, it doesn't matter how good you are. I could marinate you in antibiotics and the infection would take hold. So Ray is calling me again. Great, Ray. What's up?
Follow up on my earlier question. I forgot to ask you, what's the difference between fasting and non-fasting blood workups? It's it seems like there must be some reason for it, and is a PSA included on it? I think that's a prostate test to see if you may have the onset of prostate cancer.
Yes.
And my second question is, Chuck Augustine gives me this literature, and it's amazing what's going on out there. There's one doctor who's going to give life in prison for telling people they got cancer so he could prescribe the chemotherapy and actually get kickbacks for every treatment they get. They found him guilty of this. He admitted to it. So I don't know if you're familiar. I think his name was Fahid or something like that. So the fasting and non-fasting, and as far as the chemotherapy, if you could comment on that. I know we're in it.
I don't travel at least for another month or two, so we should be.
Next week is Martin Luther's birthday, and I don't think Martin Luther King, and I don't think the station's going to be on. They usually take the holidays off.
Well, if they do, then there will be a rerun. But if we
all right.
If we got a live show, I'm going to be working on that Monday. So I don't know. Noah was trying to tell me, yes, sir, we're going to be on. Yeah, we're on live next Monday.
All right, it's good news week. Thank you very much.
You're welcome. So let me try and answer those questions. The idea behind fasting and non-fasting is basically to assess sugar and cholesterol. So you want to see whether or not what your sugar level is, and normally fasting blood sugar, if you're non-diabetic, should be around 85 to 80. It could be lower depending on if you have a high circulating insulin level. But, and if you're higher than 100, 105, you could be in this pre-diabetic state, and if you're 140, then you probably are diabetic. So that's a good way to assess blood sugar. Now, it also affects lipids. Your cholesterol is about a 48-hour duration. So if you had a bunch of steaks and a bunch of saturated fat a couple of days, it may take that long for it to get processed into cholesterol and elevated. But it is very important with triglycerides, and triglycerides are a fasting issue. So you must be fasting at least about 8 to 12 is. The longer you can go is better for triglycerides. For sugar, probably an 8 to 9 hour fast would be good to assess your blood sugar. You also asked about PSA, and PSA is prostatic specific antigen, and yes, it would be a part of a regular panel on someone over the age of 50 where the risk of prostate cancer becomes more of an issue. It by itself is an antigen secreted by the prostate gland, and 30% of the prostate gland does not make any PSA, so it's not a foolproof test, but it usually determines the size. You can make some relative determination. PSA, not only is an absolute number, anything greater than 4 is elevated, greater than 6 is alarming, greater than 9 is prostate cancer until proven otherwise. Also, what's important is the rate of change. If your PSA is 1 and it goes up to 1.1 and 1.2 after every year, and then all of a sudden it goes to 3, well, you could have had prostatitis, or it might be prostate cancer. So that's where your clinician comes in and makes a decision on what. And in my case, when I see that kind of elevation, I usually give somebody a short course of an antibiotic, maybe 2 weeks, to make sure they don't have prostatitis. And then from that point, I will recheck it if it comes back down to normal. You should see PSAs go down in time as you get older, only because your testosterone decreases. So testosterone causes the prostate to grow. So if your prostate kind of is what we call autogenous, which means it starts to grow on its own, even though your testosterone levels are going down, then prostate cancer becomes somewhat of a concern. But nobody gets out of here alive. Then you raised your question about this chemotherapy. You know, I just don't live in a realm where I can, and I call it prostitute patients for the sake of, you know, ordering tests and ordering labs and running up the healthcare bill, because it's just, I mean, that's just one form of doing that. I believe every test should have a reason to be done, and I'm looking for something to be specific. I never order a test just to do a test. Sometimes the tests are inconclusive. And one always has to keep in mind that modern medicine, as much as it's modern, is not. There are diseases and situations out there that we just can't detect, and we haven't defined, and therefore we don't know what test to develop to look for it. Hepatitis C is a great example. I mean, all we knew was about hepatitis A and B. It took us a while to find C. There's also D and E, hepatitis D and epsilon. I mean, these are just cases where they come up out of nowhere. Nobody really knows what they are. So for a doctor to basically tell patients that they have cancer, just to order chemotherapy, you know, it's lower than low. I mean, it just, yeah, I mean, people like that should be taken out back and skinned alive. I can't imagine doing that to somebody and having a conscience about doing that. But there are a lot of people out there that do a lot of evil, and it's just a constant reminder of man's inhumanity to man, and how barbaric we still are in some areas, and how evil some people can be. And as a patient out there, if you're told to do something, a lot of people just believe it on face value. I think you should always, if there's even a modicum of doubt in your mind, to get a second opinion and check things out before you relegate yourself to surgery, and things that are could be life-changing issues. Always be very careful. It never hurts to get another opinion. If the two conflict, you know, what do you do? Well, then you get a third opinion. But a lot of times information is really cheap, and repairs are really expensive and they're costly. So, you know, somebody going in for their, you know, third knee surgery is usually a pretty good indication that it's not going to get better, because of scar tissue and healing issues like that. So, you know, be aware, be wise, always question everything. It never hurts to, you know, if you trust your provider and you know your healthcare provider, your doctor, your nurse practitioner, you feel confident, and that's fine. If you get a diagnosis, make sure that the information matches. That's all I can tell you to do. And I really think like people like that don't deserve to be on this earth. So with that, we will close. I thank you very much. Great show. Thank the audience for calling in. I'll see you same time, next place in a week. Have a good night.